Good morning and welcome to this week's episode of Ask Dr. Murphy. I hope everyone is doing well today. My name is Katie Berg. I'm a research study coordinator with the Havey Institute, and I'll be leading today's discussion. I'd like to welcome and introduce Dr. Robert Murphy. Dr. Murphy, how are you this morning?
Doing well, thank you.
Dr. Robert Murphy is the executive director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. He answers your COVID, infectious disease, and public health questions each week here on the Havey Institute for Global Health's Facebook page. Today, Dr. Murphy will be addressing the latest headlines and our lone US COVID statistic, which we'll have a note on, but through today, October 17th. We invite you to submit any questions or comments down below at any of our social media linked in the description. And starting with that COVID statistic, last year in 2024, there was 115 daily COVID deaths. Unfortunately, during the current government shutdown, we do not have updated COVID mortality numbers. But Dr. Murphy, your reactions on the general state of COVID here in the US?
Well, we don't have anything really to report because the people that are reporting it are furloughed. So not too much to say, but most likely it's much lower numbers than in 2024. So, but otherwise, there's really nothing we can say. So this is kind of the calm before the official winter season, which kind of starts taking off in December and really jumps up in January, February, and March, where it starts to go down. So then we have to watch out for COVID, RSV, and flu. So get your vaccines ready and try not to get those diseases. And if you get one of them, if you get COVID, or if you get the flu, there are treatments that are available, especially if you have any underlying medical conditions or getting up there in age.
And on the topic of vaccinations, right after our episode last week, we recorded and posted, the ACIP and the CDC did expand those COVID approvals for the vaccination. Can you tell us about the group that was included?
Yeah, so this is involves pregnant women. So they first didn't want healthy pregnant women to get the shot. And there was such an uproar that even the people that are running the show trying to stop all the vaccines, even they caved. And they changed the recommendation kind of quietly, and they expanded the COVID coverage to pregnant women. The reason for that is that pregnant women are particularly at risk for severe COVID and complications, including death. During the beginning of the COVID pandemic, maternal mortality, that's pregnant women getting sick and dying, was at a 50-year high because of COVID. And the vaccine works very well, and it not only protects the mother, but it protects the baby as well, because the antibodies that the mother makes are passed to the baby. So the children are protected as well. So now the guidance is clear that the vaccine can be COVID vaccines can be administered to pregnant women, and all the insurers and all the payers and stuff should be covering this at no charge. Now, there's been issues. People say, I don't want to take the vaccine because I'm pregnant. Well, okay. The French, they have a centralized database of basically everyone in the country and their health records. So they took a look at congenital malformations in women. They examined over 500,000 infants, and they looked at malformations and vaccines. And they had plenty of people that were not exposed, plenty of infants not exposed to vaccines, and ones that were exposed to vaccine. And what they showed that and the French predominantly use the mRNA vaccines, the Moderna or the Pfizer. Typically, it's the Pfizer. That there was no increase at all in any infant deformities or problems or any kind of malformations at all, and that the vaccines are safe for the babies. And of course, the mothers do better in pregnancy because their mortality rate is much lower if they take the vaccines. So um, this study really confirms the fetal safety of the mRNA COVID vaccines during pregnancy, showing that there's really no increased risk of any real problem due to the vaccine, and that it really just benefits the mother and the baby.
Absolutely. That is a very impressive study and adds to the mountain of evidence that we have seen coming out all over the world about the safety and efficacy of these vaccines. But if we move up one more age group to young children, here in the US, parents have been striking out, getting turned away, trying to get those pediatric COVID shots. Can you tell us about why?
Well, there's been so much back and forth with are the vaccines going to be approved for kids, and they healthy kids aren't going to get it. We've discussed before. Now, there's only a few hundred deaths per year from COVID, but they include many healthy children. It's not just kids that have other underlying illnesses, and that's why COVID and flu vaccines had been approved for every kid 6 months and older. And now they're trying to tweak it. Oh, the kid's healthy, you don't have to take it. Killing a couple hundred kids, that's a big deal because kids are not supposed to be dying of preventable diseases. Um, so then these recommendations, which are completely in disagreement with the American Academy of Pediatrics and other professional societies, it has everybody so confused. And of course, they don't know if the insurance will cover it or whoever the payer is going to pay for it. And a lot of people just throw their hands up and they're not giving the kids the vaccine. So you're going to see kids in the hospital with COVID this year because so many people are not getting the shot. And then to confuse things even more, the Moderna COVID vaccine is approved for those 6 months and older, whereas the Pfizer is only approved for ages 5 and up. They had emergency use authorization down to 6 months, but when they applied to give it to the full approval, they didn't get it. And there's no reason. I mean, they didn't really give any reason other than they're just not going to do it. So at some places, different hospitals price the vaccines out. They work pretty much the same. And like at Northwestern, the preferred vaccine actually is the Pfizer vaccine, but they have the Moderna vaccine too. But so it's just another craziness out there that is going to limit the public health benefit because people are just they can't deal with all these obstructions and uncertainties, and a lot of places are not even stocking these vaccines for kids. So it's just a shame.
Yeah, that's a really important note there at the end that a child doesn't take the adult vaccine. There is
No,
a pediatric
pediatric dose.
vaccine.
Yeah. So, at the end of this respiratory season, we're going to see the numbers, and it's going to be very disappointing what is happening out there.
Mhm. And adding to more chaos that we are seeing in the public health realm, just at the end of last week, there were mass firings and then rehirings at the CDC. Can you tell us what happened?
So the CDC had been a really great organization that, tracks diseases, makes recommendations based on science. The whole place is just in, you know, uproar and chaos. First there were cuts that the Doja people put in place, and then the head of it was fired, terminated because she believes in science, and they put a finance guy in charge of the whole thing. That's really smart. And then just recently they fire 1,300 more people. And then they realized that they fired all the people that are tracking all the diseases they actually want to follow. So they like within a day or two they rehired 700 of the 1,300. I mean, what kind of management is this? They're destroying actually an organization that worked very well. And they're not replacing it with anything but just chaos. And the experienced people are leaving or getting terminated. And I mean, you basically you can't rely on anything coming out of the CDC these days. People are now turning to the states and cities that have health departments. Illinois has a very good one, and people in Illinois are following the Illinois the state health department guidelines, which are basically the old federal guidelines, the ones that are based on science and make some kind of sense. So it's follow the state in this particular case. And states are banding together in little groups. California, Oregon, Washington, and Hawaii are one group. There's other groups on the East Coast and elsewhere, and they're following those particular recommendations.
Now, another decision, if put into effect, that could be very detrimental to the current vaccine stock here in the United States is about aluminum and vaccines. Can you just break down the whole issue for us? There's so many buzzwords. What is it actually about?
Yeah, so aluminum is put into some vaccine products in this like microscopic amount. Um, and it keeps the vaccine safe and working properly. It's been going on since the beginning of vaccines. And all of a sudden, people are saying, oh, there's aluminum in vaccines. Okay, there's aluminum in every metal can that has a soft drink or beer or whatever in it. Okay. Many pots and pans have aluminum. There's aluminum in the dust. There's aluminum all over the place. You're exposed to aluminum. You have aluminum. The amount of aluminum in a vaccine is this microscopic amount and has never been shown to be detrimental. You look at many studies where people got a vaccine or didn't get a vaccine, nothing, there's no difference, okay? So this tiny amount is causing a big political issue here. And it's if they ban the aluminum containing vaccines, 50% of the vaccines that children take to prevent horrible diseases like whooping cough and polio and all the other vaccines out there that use it, half will come off the market. And it's not like you can just say, oh, I'll go order the non-aluminum ones. They may not even exist, number one. And number two is you just can't flick a switch and just switch over. They don't have the ability to absorb that much coming out of the market. It's just a disaster. And if you're really worried about aluminum, stop drinking out of aluminum cans and don't cook with aluminum pots. That's for one thing. But this is life-threatening in many cases if this does get removed from the market.
Yeah, and just as a asterisk there, these aluminum salts are measured to 1 millionth of a gram. 1 millionth of a gram, that is smaller than a grain of sand. So just keep that in mind.
Well,
But moving on to
a grain of sand is much bigger than a millionth of a gram.
much bigger.
It's much bigger. A grain of sand is like a boulder. But anyway, it's very sad. These decisions are being made without any thought to scientific integrity. It's just very much very sad.
Yeah. And switching gears to one of our long-running stories, the measles outbreak here in the US. No signs of slowing down. Can you bring us the latest updates?
Yep, new cases popping up, Minnesota and South Carolina. South Carolina was worse. They had 16 kids, which put over 130 in quarantine at two different schools. So if you look at this South Carolina case a little more closely, they found that the vaccine uptake in some of these schools was as low as 17%. and the other school I think was close to 50%, something like that. For measles, which is so contagious, kills 2 to 3 people out of per 10,000, whatever, you need 95% vaccine coverage to prevent an outbreak. So this data here is telling us that this measles epidemic is not going to go away in the United States. It didn't go away in many countries that couldn't get up to 95%. There was always measles cases happening. So this is what's going to happen in the United States now, especially with the uptake that low. Very unfortunate because you can get hospitalized, you can get sick, and you can die from measles. So, we're going back to what it was like in the early 1950s before the vaccines became available. And there were just always measles cases popping up just everywhere all the time. And people just accepted that until the vaccine came out. And it's very unfortunate because, of course, it's totally preventable and, proven safe. But people just, some people are just not taking the vaccines now. Well, they're going to pay the price. The children will pay
Yeah.
the
50% vaccination coverage is alarming. 17% is a
price.
shocking number to hear.
Shocking number. When I read that report, I couldn't believe it was that bad. 50% is horrible. I mean, 80% is bad. 90% doesn't go. So you got to have 95%. Oh, well.
Wow. Yeah. We'll keep an eye on that spread there, but something that is popping up a lot less, thankfully, than measles is chikungunya virus, which we haven't talked about much on this show. But there was the first locally acquired case in New York. Can you tell us about it?
Chikungunya is another one of these viral diseases. People get sick. Some people don't have any symptoms. Some people get a little bit ill. Some people get a lot ill, and about 1 in 1,000 die from chikungunya. So you got to be careful with chikungunya, especially if you have any other underlying diseases that this could tip you over into something really bad. Most of the cases in the United States up until now have come from people who've traveled abroad in areas where there's a lot of this disease in the tropics and whatever. And lo and behold, we got an endogenous case here in Long Island. This is a Nassau County on Long Island. Now the person had traveled around the region, so we don't know exactly where they picked it up. Mosquito-borne, and they got a lot of other diseases out there that mosquitoes transmit. But the person had not been abroad. So this definitely came from that area, New York area, probably other parts of Long Island. So that's an interesting case.
Yes, very interesting. And I believe in the United States, it's the first locally acquired case in something like 6 years. So this is very rare, but not something we want to, give grounds to grow.
Very rare. Mhm.
Now, something that has dwelled down a little bit, but seems to be back up on the rise is the H5N1 avian flu. We've been seeing some more cases in poultry. Can you tell us why you think that is?
Yeah, so we talked about this more in the past couple of months, and then it kind of just died down a little bit. We weren't hearing too much about it, but this is the migratory period for birds. The birds up here are heading south, and they think that that's probably what's causing this. And so there are a lot more flocks of birds and stuff are getting impacted and having to be culled. They are seeing the same thing in Europe. There's a big outbreak in northern France. And backyard poultry in Montana, Arkansas, Idaho, and Oregon have also reported these cases in flocks of birds, turkeys, and other farmed animals. So it's back. And so it still hasn't mutated. Our big fear was it was going to mutate and then humans could spread it between each other. And so the risk is just in the people working with those animals. And that's good that happened.
Yeah.
But things could change, and that's why we need the surveillance. Hopefully, those people haven't been laid off, or they were part of the 700 that got rehired from the CDC. But we need to stay on top of that one. There are vaccines available for this. They're not released yet. They're holding back until the numbers really pile up. But there's millions of doses in emergency stockpiles.
Mhm. When we were last talking about this, there was around 70 human cases here in the US and just one death, which is relatively good proportion. I mean, it's never good to have someone pass on, but overseas, the mortality rate has been much higher historically.
Yeah, the Cambodians in particular have reported mortality rates as high as 50%. And we still don't understand exactly why that is. But the Asian populations that are being impacted by avian flu, the humans, have a much higher mortality rate than here. We don't really understand.
So that's why we need more time, money, and funds going to answer those questions and research. But our last story today is something that will need even more than that. The topic, antimicrobial resistance. It keeps going up all over the world. Can you bring us the latest updates?
Well, the WHO, which of course the United States has left, is really the kind of global monitor, and many countries report their health data into the WHO database. And one of their projects is global antimicrobial resistance. This is antibiotic resistance. They had 104 countries reporting in, and from 2018 to 2023, antibiotic resistance rose more than 40% uh, over that period of time. Um, the average annual increase is 5 to 15%. I mean, we've known this has been a growing problem, but this is some very hard data to show that it's like really, really worse than expected, worse than we thought. It boils down to 1 in 6 infections worldwide um, are resistant to the usual drugs that are used to treat those infections. So this is everything: pneumonia, urinary tract infections, skin infection, gastrointestinal infections. So 1 in 6. And it's getting harder and harder to treat people for infections. And we are not really developing many new drugs to treat these infections. It's very difficult to get pharmaceutical companies and any kind of company to work in this particular area, because first of all, to develop something like that could cost billions of dollars per drug. And once the drug gets out, to avoid that drug becoming resistance, the stewardship professionals who are advising on the antimicrobial use, antibiotic use in hospitals and clinics and the like, would limit the use of a new drug to only select people that really fit the criteria for taking the drug and for the shortest amount of time. And that's not how antibiotics are typically used. They're typically, oh yeah, you don't feel good, you take this, you take this, you take. And that's what's caused all this resistance. And oh, take it for 5 days, take it for 7 days, take it for another week if you're not better. And they don't even know what they're treating. If you actually do all the testing, you find out that people are using antibiotics mostly for viral diseases, which doesn't do any good at all. But it's changing the flora of the bacteria in the body and selecting for resistance to the drug. Now, the diagnostics world is improving. And pretty soon you're going to have available, if you have a respiratory tract infection, you have cough and fever, whatever, you'll be able to go in. Now you can go, you can get a COVID test, you can get a flu test. Well, pretty soon, probably in the next season, not this one, you'll be able to get a test for all the major causes of a respiratory infection in one like test. So that's going to be great. And then the same thing for urinary tract infections and skin infections and all the other infections. There'll be like what they call multiplex testing platform that you can hopefully, a lot of this stuff is being geared towards outpatients, toward the pharmacies, and as long as they're accessible. So that's another big thing. Not everybody is going to go cough up $22 for 2 COVID tests. And the same is going to be true here. But, at least we're going in the direction of making it easier to diagnose, because if you know the diagnosis, you won't, A, waste the money and further develop antibiotic resistance by taking drugs you don't need. So that's the future. So that part is going good. The new drug part is not going good. And this is where you need a really public health effort and a government plan to help develop these drugs. I mean, we developed the COVID vaccine in 10 months, 11 months. That was amazing how fast that happened. And so we can do it if we have the will. Right now, we don't have the will. We haven't had the will for a while. It's not just the current government, it's all the past government. People have just been ignoring this problem with the resistance. So it's everybody's fault.
Yeah, it's a big problem and one we'll continue to cover as time goes on. But on that note, I'd like to thank you, Dr. Murphy, for your time and your expertise, breaking down all the latest stories and data for us. It's much appreciated.
Great. Have a great weekend.
Thank you. And thank you all for joining us for this week's installment of the Ask Dr. Murphy series. If you have any questions or comments, please leave them down below or at any of our social media linked in the description. We'll see you next week and have a nice weekend.